Welcome to the webinar. On behalf of Western Victoria Primary Health Network, it is with great pleasure that I welcome you to the webinar for executive and board members of residential aged care homes in the Western Victorian region for the Residential Aged Care Home Change Management Training Program. We've got a mouthful there, but we'll get through these. So thank you for taking the time to attend this very important training opportunity. We appreciate that you all have busy schedules and value your commitment to the change within your organisations. So to introduce myself, I am Nigel Jarvis. I am the Executive Director of Finance, Commissioning Contracts at Western Victoria Primary Health Network. And who are we? Well, we were established in July 2015 as a not-for-profit charitable organisation and was originally charged with delivering on the following two objectives by the Commonwealth Government, and that's to increase the efficiency and effectiveness of medical services for patients, particularly those at risk of poor health outcomes, and to also improve the coordination of care to residential patients to receive the right care in the right place at the right time. So how the Healthy Ageing team supporting you? Western Victoria PHN are committed to quality and accessible primary healthcare for Western Victoria. The Healthy Ageing team within our organisation is responsible for providing tailored and targeted support and education for RACs within our catchment. So we support 139 RACs in our region, and they extend from the West Wimmera and Glenelg Shires in the west to Geelong and Queenscliff in the east, and as far as Hindmarsh, Yarrambiarrick in the north, and Warrnambool down to the south. So today's program is commissioned by Thrive Aged Care Consultants, who are your presenters today, and they're here to provide change management training to RACs staff, clinical, managerial, and support staff specific to the RAC setting, and to also enable participants to have improved capability and capacity to implement and cope with digital changes in the workplace. Our catchment has been exposed to the need for the change management to overcome barriers to the wider implementation and application of digital technologies within the residential aged care setting. The RAC Change Management Training Program will contribute to overcoming barriers for telehealth adoption by RAC staff, enabling staff to feel confident, committed, and to implement digital technologies, as well as being integral to their part of the healthcare delivery, and with a long-term aim of improving health outcomes for residents living in aged care homes within the WVPHN catchment. So today you'll be receiving expert guidance with an opportunity to ask questions about how the program can support your organisation. And with that, I'll now hand over to Kate Lamont and Kathy Kirby from Thrive Aged Care Consulting. They're the experts in change management and supporting aged care staff to thrive. So thank you and enjoy the webinar.
Thank you, Nigel. Thanks for that lovely introduction. So thanks everyone for jumping on today. Before we get into it, we'd love to just tell you a little bit about ourselves, a little bit about Thrive Aged Care. So Thrive Aged Care, our mission is to work with health and aged care providers to support organisations through three different ways: organisational support, education, training and mentoring, and we have some specific dementia training and support that we offer as well. It's really about working with you guys to set you and your teams up to thrive. Now, Kathy and I are passionate clinicians. We have worked in the health and aged care continuum for over 20 years. Myself, I'm an OT. And yeah, clinically, my passion is working with older people and people living with dementia, but I've also done quite a bit of work in policy development, working for the state government, in quality and safety, working for Safer Care Victoria, and project management and program management. I'll let Kathy jump on and say a quick hi.
Yeah, thanks, Kate. Hi, everyone. My name is Kathy. I'm a registered nurse by background, and like Kate, I've been in the industry for over 20 years. Like Kate as well, I have a very big passion for supporting older people and particularly people living with dementia. And I can see a few familiar faces and names in this group today, which is always nice to see. I've worked in lots of different roles, including as well for the Department of Health as a nurse advisor, and I've worked as a nurse advisor privately supporting aged care facilities who had some issues around compliance or other serious sort of issues and supporting them through that. So really loving working with Thrive, with Kate, and supporting our people who care for older people through that education and training such as what you're going to hear about today. So thank you all for coming, and I'll talk to you a bit later.
Thanks, Kathy. Yep. So if you know how we work, we're a bit of a tag team. And it's going to be a bit of an interactive session as much as we can make it. So feel free to get your fingers ready to type in the chat, because we'd love to hear a bit about you guys as well. Before we start, just to let you know that this webinar will be recorded, and I believe you've seen that little comment pop up that Katrina's recording this. And there will be a copy, a recording made available, so you can watch it back or you can share it to colleagues that might not be here today. Everyone's on mute, which is fantastic. It makes the recording much easier to listen to. But if you do have questions or comments, please pop them in the chat and we can pause throughout the session and respond and answer those and have a bit of a discussion and a chat. Don't feel like you need to take copious amount of notes. We will be sending through a copy of today's presentation. So again, you can have a bit of a look at that as well. So we've introduced ourselves and we'd love for you to pop in the chat a little bit about you. So just introduce yourself, let us know where you're from and what your role is there. And we'd love to know your why. Why do you work in aged care? Now, this is a question that we have been asking residential aged care staff who have been part of our course to date. What gets them out of bed every morning? Why do they work in aged care? Why are they supporting their residents each and every day? And we've loved hearing the answers. So we're really interested to hear your answers. So pop them in the chat, and as we go through the next slides, we'll read them out a little bit. Thank you, Meg, for starting off. It's always the hardest, the first one, and thank you, Susan. And if you can think about your why, pop that in the chat. That'd be great to see. So why the focus on change management? That's the nice little segue. Why the focus on change management? You know, that's really interesting. So Western Vic PHN have done a lot of work in digital health and telehealth. Prior to this project, they worked on giving you guys grants. So you might have been a recipient of the small grant program, which meant that you received up to a bit over $5,000 to put towards technology to support telehealth. Or you might have been part of the Vision Flex program, which meant that you got this kind of equipment here, similar to a cow on wheels, computer on wheels, isn't it? Cows. So Western Vic PHN with other independent consultants evaluated that program, either receiving a grant to enhance the use of iPads or other technology, or Vision Flex. And they found that both programs actually improved access to health specialists, to timely care, and improved communication for residents, family, and care providers, which is fantastic. They found that the portable equipment, the iPads, were easy to use. Obviously, we're using iPads and smartphones every day, so staff and residents and representatives found that technology easy to use. There was findings that Vision Flex was fantastic. Staff loved the technology and the amount of detail and how it could really facilitate really specialised appointments like wound care appointments, etc. But they did say that the Vision Flex equipment was a little bit harder to use. But a key recommendation from this evaluation was it was important to enhance staff's change management skills so that RACs with their own teams could continue to enhance and develop the use of telehealth and digital health themselves. And that's where we came on board. Yeah, so that's why the focus has been on change management and really working with teams to support them to get thinking about how they can grow and enhance the use of telehealth and digital health. I'm going to pause for a second because I can see lots of whys coming through, which is great. So welcome everyone. Thank you. We've got a mix of exec and board, which is fantastic. Improving conditions for all residents. That's, yeah, amazing. Making a difference. Feels good to know what you do matters. Yeah, bringing comfort and care to people who need it the most. Yeah. Oh, okay. You enjoy being challenged with constant change. Well, you're in the right spot, because the only predictable thing about aged care at the moment is that there is always constant change, isn't it? Yeah, we're going to touch on that today. And rural aged care deserve best quality care with equity of access. Yes, exactly it. And to support healthy ageing in rural communities. Exactly. And we're going to touch on that today as well. So thank you so much for telling us a little bit about yourself. Oh, someone's taken control. I'm just going to take that back. All right. So what is our training about? We have been commissioned by the PHN to develop and deliver a suite of training around change management with a focus on increasing the use of telehealth and digital health at Western Vic RACs. And what that includes is we have been fortunate enough to work with two RAC services who applied for and received bespoke programs. So we've actually just wrapping those up. So we've worked individually with two services to deliver really bespoke change management training. We're working with you guys. So we've got this session today for board and exec, and we've got another session. It's the same one, but we're just running it 2 days tomorrow for people who can't make today's. We're also kicking off next week regional training workshops. So the PHN have commissioned us to come to you, which is fantastic, in your communities and offer all-day training, which is accessible for your staff to get to. So we're so excited. That starts on the 28th of April. And pop in the chat if you've got any staff coming along to those trainings. Yep, so we're going all over. I'm starting in Nell. I think Kath's starting in Warrnambool, and we're covering the Western Vic area. So pop in the chat. Now, if you don't know that if you've got staff attending, or maybe you haven't booked in yet, it's not too late. You can always email Katrina, who's on today's webinar, and she can get your staff in. The more people, the better. We want to see the rooms packed, and we want to be able to work with your teams. Now, we also have worked with the PHN to develop up a digital health collaborative. We're going to talk to you about that at the end. But basically, once this training's over, something else is coming that is going to sustain the focus and the collaboration and the work that you're doing in the space of digital health and telehealth, which is exciting. On top of all of that, we are working with an independent consultant who is going to evaluate how we've done. So we're working with KF Consulting, and we are surveying participants who come to the training and also offering the opportunity to be involved in more in-depth interviews. So the PHN will have an evaluation of how we've done and the impact that it's having for your teams. So what is this training all about? Yep. So the training has been developed really to get people to think about why. Yep, just like your why. Why is telehealth important for resident care and experience in aged care? And not only to think about the why, and so we're linking that to clinical governance, but also how. What skills do you need to really be able to test a change, to know that it's an improvement, and then to be able to roll out and support the people that you work with to embrace that change and to want to be part of it. So you can see here on the slide, we focus on clinical governance, which we see as the why. We're upskilling participants with their confidence and knowledge about how to use data, because data is important. So you're going to hear a bit about that today, how to use data to monitor performance and to drive change. And we also introduce participants to a quality improvement model. So we'll tell you a little bit more about that today, and a change management model. On top of the training, we've developed a suite of very practical change management tools. Now, the focus is on the frameworks, not the tools, because change is not just about completing paperwork. The paperwork is important to manage projects and to manage change, but really our focus is upskilling and building capability in your team to feel confident, to lead change, and to test ideas. We're looking at training about 140 RAC staff, which is amazing, like I said, across those two bespoke services that we've been working with, and also the 7 regional sessions that we're running as well. Now, we've noticed that participants so far have included a mix of staff. So if you're thinking there's some people that you still want to send to the sessions, please do so. Staff who might be in quality roles, staff who might be in project roles, care staff. We've had PCWs come along to our training. We've had nursing staff. We've had non-clinical leaders as well. So a really great mix of different roles and different experience levels, from new grads right through to people who have been, working for a long time in aged care. So today, your session, what is it about? Well, it's really an opportunity to think about how you currently use telehealth, and maybe you might generate some ideas about how you could use it differently at your RAC. It's to tell you a bit about what we've been doing with your staff, your participants who are attending our session as well. So we've been working with them to really think about clinical governance, quality improvement, using data to drive change and change management. So really, it's a top-down approach talking to you today and a bottom-up approach with the work that we're doing with your teams. So really, today is an opportunity to really think strategically about how you might plan in your role to enhance the use of telehealth and support your leaders with their skills that they're learning in quality improvement and change management, because that hopefully they're going to come to you with lots of ideas. Yeah, they're going to come to you with lots of ideas about how they can do things a little bit differently to give your residents great care and experience through the use of telehealth. So today is an opportunity to think about, like I said, how you can enhance telehealth, identify and discuss maybe any challenges that might stop you using it to your full capacity, connect with other people who are on the call today, share ideas, and really just make a little plan yourself about what things you might follow up to enhance the use of telehealth at your RAC that you're representing. Before we get started, it's really good just to be clear on what digital health and telehealth is. So we will pop this slide in just so that we're on the same page when we talk about digital health and telehealth. So digital health is that overarching term that we use for digital health solutions, and telehealth sits under that. But digital health is really about electronically connecting up points of care, so health and aged care, so information can be shared securely. Okay. Telehealth is an alternative to face-to-face consultations. It can be done by a telephone, it can be done by a video, and it's done by qualified health practitioners. Okay. Some examples of what we've heard, how telehealth and digital health are being used in Western Victorian RACs are here. So we're hearing that telehealth is used quite a lot for virtual ED appointments, which is great, allied health appointments, and to enable residents to see their GPs or medical specialists as well. If you've got any other ways that you know of telehealth being used at your RAC, please pop that in the chat. Always, keen to learn if we've missed anything. Some examples of digital health, how we're hearing it's used in RACs in the Western Vic PHN is electronic medication charts, electronic discharge summaries, My Health records, e-referrals to other providers. And again, super interested if you've got other digital health solutions that you're rolling out at your RAC as well, please pop them in the chat. Okay, so there's been a big investment in telehealth and digital solutions by Western Vic PHN and by lots of different aged care providers as well. Your organisation that you're representing today might have made a big investment in that space. But are we making the most of the opportunities that we've signed up for? Are we measuring our success? Do we know how successful we're being with the use of telehealth? Where have we gone well and what can we build on? Because it's always thinking about continuous improvement and what areas that we can build on to really make the most out of our investment. Yeah. So are you using telehealth for these areas? Are you using telehealth for GP consultations, specialist consultations, accessing virtual ED? Mental health support. We know mental health is a big focus in the new strengthened standards, and we've heard from providers accessing timely mental health support is very, very difficult in regional areas. Remote patient monitoring. And are you seeing these things? Are you measuring these things? Are you measuring timely access to care? Are you measuring the impact that your telehealth is having on travel time or costs? Are you receiving feedback from residents or representatives by offering them choice to see people face to face or perhaps to access more timely care through telehealth? And what about access to specialists? Are you monitoring any data around that? How long it takes to see a specialist, or perhaps the impact on your residents heading out to see that specialist? And I'm seeing some comments come through. Yep, so Vision Flex, exactly, Kathy. Vision Flex was one of those tools that we spoke about at the start, and you're using it for virtual ED, neurologists, geriatricians, wound clinics. They're your main reasons for telehealth. Great to hear. Thank you, Kathy, and feel free to pop yours in the chat as well. So that's what we want you to think about today. How well are you using telehealth? What opportunities might still exist to enhance its use? Are you facing any barriers, and what are those barriers? So when we think about enhancing telehealth and digital health, there's some considerations that may present as challenges. However, today we want you to think about, are these real or perceived challenges? And they might be a bit of both. Yeah. So the thought of real versus perceived challenges is something that we have been focusing on in our workshops with our aged care leaders, getting them to really interrogate and really think about, is this barrier that I'm facing real, or is it a perception? Yeah. And how do I then address those barriers to get people on board with change? So some things that we've got down here, one of them is digital literacy. This might be related to our workforce, or it might be related to our residents or representatives that are using telehealth. And what we want to know, is this a real or a perceived challenge? And how will this look each year from here, with people being more and more open and skilled, perhaps, at using digital solutions in everyday life? We know we've got the baby boomers who are starting to come into aged care, and we're going to see more and more baby boomers accessing aged care, home care or residential care. And how will this look for baby boomers entering our system? Also thinking about the workforce, we probably have a mix of older and younger staff as well. And I see some comments. Thank you, Kathy. This is great. Barriers might be new staff, longer term staff having difficulty with digital literacy limitations, paying for your own battery pack, around Vision Flex. Okay, it means to come out of your own site budget. Yep. So some, things to really consider. Yep. And thank you to your clinical manager. Thank you, Megan. I can't see you in the screen, but it's awesome. Privacy and security, and this is something else. Is this a real or perceived barrier? It was actually really interesting when the PHN did the evaluation to telehealth. They conducted some interviews with residents and representatives who had used telehealth, and I don't think there was really any concerns from residents or representatives about privacy or security, and that was a question that was directly asked into their experience of telehealth. So, again, we have to balance out. Yes, there are probably some real challenges in that space, but sometimes is it our perception as well? Equitable access, and I think John made this point at the start, which is brilliant. Equitable access to medical practitioners and specialists and allied health practitioners. And we know that this is a very real issue, especially for you guys out in regional and rural towns. How does this provide challenges? It does, doesn't it? That you've got you might have very limited access to certain medical or allied health specialists. But does it also provide an opportunity then to do something differently with the use of telehealth? And that's what we like to talk about at Thrive. Yes, there are some very real challenges, but from challenges spring opportunities. We have to look at things a little bit differently sometimes to find those opportunities. Okay. So all organisations will be at different readiness levels in regards to how prepared you are to implement and sustain changes, specifically in the areas of telehealth. Okay, now we developed with the PHN a change readiness audit tool specifically in the area of telehealth. So let us know in the chat if you've completed this tool. It was called the Change Readiness Audit, Telehealth and Digital Health. And basically what it was an audit to look at, to assess your preparedness in different areas so that you'll know what your strengths are and perhaps where your areas of improvement are to really drive and sustain change in telehealth. So we, Katrina, sent this out when you would have registered staff for the regional workshops that are coming up. And a leader in your organisation would have been tasked with completing this on behalf of your organisation. There was 29 questions in 3 key areas, and those key areas were organisational readiness, operational readiness, and stakeholder readiness. So there was 29 questions that really got you to think about different things in each area. In regards to organisational readiness, it got you to think about how your organisation has considered the need for telehealth. Have you actually identified a need and how to enhance its use? You know, the niche, your vision, how you want to enhance its use. It got you to look at how your leaders are driving this need, and it got you to look at your existing governance structures, how, you know, what you've got in place to really support and embed change strategically across your organisation. Operational readiness focused on workforce, technology, and space. So what you actually need to make it happen. You know, are your workforce trained, skilled, competent, confident in telehealth? Do you have all the equipment that you need? Do you have space set up to really support the use of the technology that you want to use? So very practical operational things. And the last consideration was all about stakeholder readiness. So it was getting you to think about your internal and external stakeholders and how ready they would be to support your vision of growing the use of telehealth. What processes or structures do you have in place already for engagement with your staff, your residents, your representatives, providers like GPs, allied health specialists, etc. So it's a really good starting point to sort of get a sense of where you're at and what areas you might need to strengthen before you invest in change and before you invest in increasing the use of telehealth. The survey took about 20 minutes, and like I said, it was completed by one of your leaders at your RAC, and it basically gave you a little bit of a score, okay, a readiness score. And like I said, the score just shows what areas might be sort of gaps that you can take as improvement opportunities. Yeah, so it showed you what you're doing well and where your improvement opportunities lie. We have got 23 audits back, which is great. And this is a bit of a graph just showing where people sit. So across the board, there's a bit of an average score of about 59%, which is just a step up from low readiness. So it's in that medium readiness, but at the very tail end of that, which shows that, yes, there are some things that we are doing well, but equally there are lots of improvement opportunities as well. Yeah. So this is a really great starting point. I wanted to highlight this because if you haven't completed it, it's a fantastic tool to sort of give you an idea where does our organisation sit and to ask some questions. Quite often, to answer these questions, you have to obviously talk to different people in your organisation to really get a sense of what could be areas that we could strengthen. So thank you, Katrina. She's popped the form up here. So you can access that yourself if you haven't completed it. And it's really a tool for you. Yep. If you wanted to share your results with us, and if you're sending staff to our regional training, that's great. But otherwise, it's a tool that really guides you to think about creating a strategic plan in how you want to enhance the use of telehealth and where your starting point's going to be. All right. So I need to take a drink, so I've got a question for you. Why is telehealth so important in aged care? Tell us your why again. And as you think of your why and tell us in the chat why it's so important in aged care, we're going to flip on to the standards. Now, this isn't the why. It's important because from July 1, we have new strengthened aged care standards. And I'm assuming everyone here knows that they're coming and that you've had a bit of a look at them. But there are quite a few points that relate directly to telehealth and digital health in the new strengthened standards. Okay. So standard 1 is all about choice. Yeah. So we see that having choice as an area where we could align telehealth, giving people the choice to stay in the comfort of their own home and see their GP or see their geriatrician and not travelling that 1.5 hours to see that geriatrician. So it aligns with choice, independence and quality of life. And it also aligns with Standard 5 in the area of clinical governance, digital clinical information systems, and 5.4 timely clinical care. Thank you, Margaret. Equity in access to specialised services. Yep, it's so good. I love when you pop your comments in the chat, because it does make this more of a discussion, which is great. So why is telehealth important in aged care? To provide a range of specialties, timely, access to all residents regardless of physical location. Excellent. Vital for resident care. Residents can stay in home instead of being in ED. Yes, on a trolley. Exactly, Kathy. Yep. Increased accessibility, convenience, cost and time efficiency. They're all great whys. Going into those statements a little bit more from the Commission into the strengthened standards, here you'll see. So statement 1.3 is about older people having choice. Now, I might have that choice one day, being at home, accessing telehealth, and then the next day I might be in aged care and that choice could be taken away from me. Yeah, so it's important that we maintain that choice when people move into care and from there onwards. 5.1 is all about digital clinical information systems. So this is more digital health solutions, integrating clinical care information with the aged care records and national health records. Access for workers and others to access information, aligned to compliance and legislative requirements, which all contributes to timely and comprehensive care. And then that 5.4, the expectation that residents have access to timely care. And this has been a big one so far from hearing from participants, the use of virtual ED, people remaining in their own home, reduction in wait times, and quite often, if an ambulance is called out, they will quite often do virtual ED before they transfer someone to hospital is what we're hearing out there now. So, being proactive in the use of virtual ED, we've been hearing from participants, has been something to really help contribute to timely care. So the standards aren't our why. The standards are the minimum standard, and we should all be working to beyond compliance. And our why is like your why. Yeah. Telehealth is important in aged care to make sure that we are providing high quality, safe care to our residents aligned with their choices and preferences. And just like you guys said, all the things that you've said really matter, remaining in their own home, reducing unnecessary transfers if they can get the same care in their own home. We know that's better for older people. We know it's better to reduce functional decline, and timely care and accessibility and equity of services, especially for you guys in the regions and rural area. This is our why. This is why we've got the focus on increasing the use of telehealth in aged care. And I'm just reading more of the comments here. Exactly. We're talking, more people are talking about VED, which is great, which does help with prompt assessment and treatment and potentially, yes, preventing unnecessary hospital admissions. Yep. And ensuring that residents receive appropriate care in a familiar environment. Yes, that word familiar too is important for so many people, especially the residents that we're supporting with cognitive impairment or dementia. So we're going to now to move into what we worked with participants on in our workshops and the why. So the why is about providing that high quality, safe care, timely access to care. And it really links into clinical governance, because clinical governance is how we know we are providing best care for our residents through a framework. And that framework is all about overseeing that what we do is contributing to safe, timely, effective, efficient, equitable and person-centred care. Has anyone here seen the Victorian Clinical Governance Framework before? This image here on your screen is the new framework. It was actually revised last year in 2024. Yeah. Now we use this framework, well, it's Victorian, because we feel like it's the most comprehensive framework, and it is suitable for both health and aged care. Okay. It was developed by Safer Care Victoria, and it is underpinned by 5 pillars, which you'll see on the screen there. So the 5 pillars are leadership and culture, partnering with consumers, workforce, risk management, and clinical practice. And in the middle of that framework, it's all about our goal, which is safe, timely, effective, efficient, equitable, and person-centred care. That is the core of the model. Okay. And around the framework, it's underpinned by monitoring. Yeah, learning, improving, and planning, which is continuous improvement. Yeah, so continuous improvement is a huge part of clinical governance. Yeah, monitoring how we're doing and working on improving aspects of how we're doing. This is the definition here of the Victorian Clinical Governance Framework, and I just wanted to point to the things that are highlighted. And this is what we've been sharing with participants who have come to our workshops as well. That clinical governance is all about integrated systems, processes, and leaderships and culture. And at the core of it is providing that safe, effective, accountable, and person-centred care. And it is underpinned by continuous improvement. And that's why with our training, we have had such a focus on continuous improvement and really building skills for leaders in that area so that they can lead and then they can apply clinical governance in all aspects of their day. The model, if you haven't checked out the revised model, we've got references at the end of this presentation, but the revised model actually gives you a bit of a plan on how to apply clinical governance. And that's the plan, monitor, learn, and improve framework. Because we all know that everyone has a part to play in clinical governance. It just doesn't happen in the boardroom. It needs to happen right on the floor with all our staffing groups. And this model, the plan, monitor, learn, and improve framework, can be applied to all of those 5 pillars. And it really is continuous improvement. Yeah, it's about having a continuous improvement mindset. And like I said before, we know that clinical governance is beyond compliance. So those new standards that are coming June 1 are our bare minimum, but we should really be looking at exactly what you said with your whys about how we can provide that timely, equitable, safe, effective, efficient, person-centred care for our residents. Yep. And high-performing organisations have these key attributes. Yeah, they have a vision for the future. They have strong consumer partnerships. They have a great organisational culture. They have a continual learning and improvement culture, strong clinical leadership, a focus on teamwork, and a focus on quality improvement. And that's what we've been working with participants to understand where quality improvement fits in and where clinical governance fits in to actually, and how to translate that to the use of telehealth. So I won't go through these slides in complete detail, but because you will get a copy of them as well, so you can have a look later. But thinking about telehealth and aligning it with the domains of clinical governance, we can see what some of the success signs for organisations might be who have a strong focus on telehealth. Yeah. So for instance, there'll be a vision about what you want your future to look like in regards to telehealth or digital health, and that vision will be shared with leadership, and that leadership will be able to share that right down to everyone supporting that resident, including the resident and their representatives. Consumers will be partnered with to help get that vision to happen. There'll be a strong focus on workforce, training, education, making sure people know what they should be doing, when they should be doing it, how they should be doing it. Risk management, so identifying any risks that might come up through the use of telehealth and monitoring those. And clinical practice, obviously, and this is where we really need to focus on data. Yeah, how do we know that we're actually making a difference? And is telehealth helping us, for instance, give more access to timely care? Yep. How do we know if we're not collecting data and monitoring data in that area? So from a clinical governance framework, these are some of the success signs in regards to telehealth. Now, I've said a few times, and we know that everyone has a responsibility for clinical governance, everyone right from the board, right through to employees and consumers and representatives. And again, this is what we've been sharing with participants coming to our workshops, which has been great. In the Victorian Clinical Governance Framework, they actually go through each group's roles and roles in regards to clinical governance. And what we've done for you today is we've put some questions against some of those roles with a focus on telehealth. So just questions to ask yourself, does this happen at this level? Yeah. And again, I'm not going to go through each of them. You're going to get a copy of them, but we might just pull out some to have a little bit of a look at. So this is board responsibilities. And a key thing that you might think about is, do we have a vision or plan for how we're going to use telehealth or other digital health technology? Is that part of our 5-year plan? Yep. Do we monitor at a board level? What data do we monitor at a board level in regards to timely care? I don't know. Does that happen at a board level, that we know that our aged care residents are getting access to timely care? What data do we collect in that area? So food for thought. I'll let you to go through all of these at your own time. CEOs, if we've got any on the call, they've got their own set of responsibilities against the Victorian Clinical Governance Framework. And again, we've put some questions down to get you thinking about telehealth if you're at the CEO level. One of these might be, are you visible to your clinical teams? Have you been able to see telehealth in action? Have you gone around and asked your staff how it's going, how VisionFlex is going? Have you asked a resident who has used VisionFlex what they thought about it? Has the vision been shared with staff? Do you have a vision that comes from the board? And then are you sharing that in your role as CEO with staff on the floor? Yeah. And again, the data. Do you review and share data around the use of telehealth and access to timely care? Some food for thought. Executive responsibilities. This might include what skills, capabilities or resources do your leaders need to make sure that you're providing high quality care regarding telehealth. This is also about data. What are you collecting regarding telehealth, and where is this being reported to? Who's involved in the analysis and discussion? And how is the data being reviewed by your clinical or care workforce? So it's important that data goes up, but equally it's important that data is shared with the people who are performing the tasks, so that they know their performance and how they're tracking as well. For leaders or managers, here's a whole other heap of questions to get you thinking. But some of them might be, do you foster regular discussion or case studies to show how telehealth is being used? Are you escalating or addressing any issues about access to resources in regards to telehealth? Have you identified any risks associated with timely access to care? And do you have any mitigation strategies that you might put in place around those risks? Employee responsibilities, we've got a list here. One that I'd like to point out is, have you got telehealth built into processes and procedures? Now, that's not an employee responsibility, although it is their responsibility to follow processes and procedures. And what we noticed on our travels is that people are using VED post-clinical incident, let's say a fall, but I doubt that it's been built into any policies or procedures. Yeah. So they're doing the right thing in terms of timely access to care, but policies and procedures haven't been updated to reflect what their clinical practice. And consumers and representatives have responsibilities too, and they can choose to engage as much or as little as they would like to. But do they know about telehealth? That's a big thing. Do they know about how you use telehealth and how they can use it when they're in their home? And are they offered choice to use it as they wish? Have you got any resident or representatives consulted and engaged if you're doing any quality improvements on telehealth? And are you proactively asking for feedback? And now we ask aged care residents a lot of questions, don't we? Yeah, we've got to be mindful that we don't just add on more questions. But after you do a telehealth session, it could be something like, and how was that for you? Was there anything we could do better? Yeah, that's how we can get feedback. It doesn't have to be us going around with a clipboard asking 5 questions every month as part of an audit. Keep it simple. Exactly, Kath, keep it simple. So this is a question for you guys. Do you have a vision for telehealth? Does your organisation have a vision? That's the first thing. If you do, what is it? And what is the focus from the board? Yeah. Have you got a bit of a plan about what you're going to do in the digital health, telehealth space? And how are your leaders supported to deliver this vision? Yeah. Kathy, one of the best incidences in the past was for a resident who had MND. All of his speech pathology, dietitian and neurology appointments were via Vision Flex. So it forced you, did something happen and it kind of forced you to use Vision Flex more? Was that?
No, we just started using it, and at that stage the battery was fine. Now we're finding it's a financial thing now, but we've got a new regional manager. So I was just saying to Megan, we're going to fight that battle again and see if we can get some funds for the next financial year that will cover that. But this gentleman was end stage MND, and of course for him to go to Geelong for a specialist appointment was just not viable. So it came at a very good time. It was really useful for someone in that end stage MND type situation. So high complex care needs, So
yeah, we've heard amazing ththings from Vision Flex on our rounds with teams that have been using it for different ways. And I think it comes down to data. What data do you collect and what data do you present to tell the story about the differences that this is having for your residents? Yeah, and why exec or the board should make a financial investment. And, what are the benefits and outcomes of that financial investment that they're going to make? Because I think just from that story that you've shared, I can imagine there'd be lots of benefits for the resident and for your staff and for your teams. Yeah, but it's how you share that story. So Kath's going to touch on that in a minute, actually. Now, this is my last slide. And it's just some questions for you to think about how to strategically strengthen your approach to make changes to enhance and sustain the use of telehealth at your okay. So we'll let you come back and have a look at these questions to really ask yourself, do we do this? Do we have this? Could we be doing this a little bit differently? So now I'm handing over to Kat. There you go.
Thank you. And now we are going to continue on talking about data, and I know Kate's mentioned it quite a lot in the first half of this session, but it's a really big component and really important component of both clinical governance and change management. And I know that you, in your roles, whether you're in exec or a board role, you would be well across the amount of data that is collected all day, every day when you're working in aged care or health settings. So data is a great example of us not always keeping things simple. A lot of time, we access a lot of data and we collect a lot of data every day. But my question to you is, how do we use it, or do we use it? And is it actually telling us what we want to know? And my first question to you as well is around what data do you currently receive at your level, at your meetings, at your when you're meeting with your teams? Are you actually receiving any data relating to telehealth already? And is it telling you the story? Is it helping you to guide you in the direction that you want to take the use of telehealth at your organisation? Because sometimes we collect data for data's sake, and that's not what we're wanting to do. Sometimes we fall back on that ticker box approach, and that's not what we want to do. It's about being useful to help us to drive and direct us in the right way towards a change that we want to implement. Okay, so we've really highlighted that when we're talking to the clinical teams in particular and the two services that we've supported, and then having a look at the services next week when we go on our road trip. We talk a lot about making sure we're collecting data that's meaningful. So thinking about what it is that we're trying to understand by what we're collecting and how we're going to use it moving forward. Because I think this quote is perfect, really, because there's no point collecting information just for the sake of collecting the information. Okay, so a key area of focus in the training is really around ensuring that the data that we collect is going to be meaningful. So we've had lots of conversation with the team members so far about what is it that we would want to look at and what can we do with that information following collecting it. Okay. So If you are collecting data already, or you have data relating to the use of telehealth coming up to any of your meetings, we'd love for you to share it in the chat. If not, that's okay, because we know that's why we're here. We're looking to improve the use of telehealth and raising that awareness. So maybe you're not currently receiving any data, but that's all right, because we're going to go through some different examples of what you might want to have a look at moving forward. So in roles at organisations caring for people, you in your roles as exec or in the board as well would receive a lot of information on a lot of different topics. So again, you're wanting to make sure that the data you're asking people to collect, or the data that you're actually receiving, is meaningful. And what we want to always remember is that we want to keep the why at the centre of everything that we're doing. Okay, so we don't want to go back to that tick box mentality to say we need to collect data to meet the new compliance standards. That's not what our purpose is. Our purpose is always going back to that why. You know, why are we wanting to improve the use of telehealth? Why are we wanting to know the effect that it's having on our residents and our representatives and our team members? Okay, so it should be telling us a story. It should be telling us about how well we're going, or how opportunities for improvement as well. So when you think about your why and your why relating to telehealth, I am asking you these questions. What is your why relating to the use of telehealth? Is it just to be compliant with the standards, which I highly doubt, because none of us are here just to tick, you know, the minimum standard. Yes, we need to meet those aged care standards, those strengthened standards that are coming in on July 1, like Kate was talking about. Yes, we have requirements around, you know, improving practice under clinical governance. But really, I think the whole idea around our why is always to see if there is an improvement. Are we making a difference? Are we making things better for our consumers? You know, are we checking, you know, what is our why? Do we want to see that we are understanding the impact of the use of telehealth? You know, is it making a big change for the person who is accessing that appointment? And I think that was just the perfect example of that Kathy just provided for her resident. Because imagine if we didn't have that telehealth opportunity, what would have happened with that resident? Because it sounds very much like that resident wouldn't have been sent to those appointments because it's too hard, or it would have been an experience that was not overly beneficial and probably very stressful for everybody involved. So is that the best outcome for the resident? No. But having a look at what the impact of that telehealth appointments has had on that resident and the resident's outcome and all of the people around him as well. The other thing that you want to think about is monitoring for risk. So what's some of the information that we could be collecting to see, you know, are there those risks associated with using telehealth? You know, thinking about things like, are we ensuring that we're using telehealth in the appropriate at the appropriate time? So like Kate was saying, we're hearing a lot of use of virtual ED. It's probably the most common appointment that we've heard being used, but we want to make sure, and you would want to make sure at your level, that people are still being sent to hospital when they should be. Yeah, so we want to make sure that our teams aren't having that all or nothing approach, that they have a really good understanding of when it is appropriate to use that telehealth appointment and when we should still be sending people in to access that face-to-face care. The other thing that you want to consider as well from your perspective is, you know, is your investment paying off? And we know we've heard about the Vision Flex and what an amazing piece of machinery it is. And we saw it when we went to one of the sites a few weeks ago, and the abilities are amazing. But, you know, you want to know that your investment, it's not cheap. And there's obviously some ongoing costs, you know, Kathy was saying as well. So how do you know that your investment has been worthwhile? How do you know that you're getting your bang for your buck? So all of these are really important components of your why. And because if you don't, you know, if you lose your why, then you lose your way. Yeah. So we need to always go back to what is it that we're trying to achieve and how are we going to get there? So the chat's been quiet, so I'm thinking maybe we're not collecting a lot of data already around the use of telehealth, and that's fine, okay? So let's have a look at what we could collect and think about the different types of qualitative and quantitative data that we're receiving, yeah? And then think about at your level in your organisation, where would be the appropriate place to receive that that data, and then what actions are you going to take when you receive that data, okay? So some things to consider are what data could you collect that assures you that your residents are receiving that timely care? And some of the things that you might want to consider are looking at your access to allied health. We know that access to allied health can be quite significantly delayed, and particularly in the regional and rural areas as well. So having a look at, you know, what are the time components for an in-person allied health appointment versus a telehealth allied health appointment? Is there a difference in that receipt of timely care? Looking at things like engaging with medical teams and specialist teams for the same consideration, you know, is there a shorter wait time for your residents to be able to receive a specialist appointment through telehealth rather than waiting, you know, 3-6 months for the geriatrician, for example, to be able to visit your service because you are located quite regionally or rurally. And obviously that emergency care, so that virtual ED, you know, how long is the wait for somebody to be seen by virtual ED versus the wait time sitting in an ED. And then from there, you can collect even more information about the outcomes, because we know that older people in ED or in acute settings, it is not the best place for them. And there are lots of other factors that can come into play. So when we can provide care at home for a resident, that is a much better alternative if that is their choice and it is the most appropriate. So what kind of data could you collect from your teams, and how can you really delve further into that to see how well your service is operating and how you could further improve or enhance that use as well? So always thinking back to those pillars as well in the clinical governance framework. So there's some really good guide there of those 5 key areas where you can just start with one question in each, one form of data for each of those pillars. The next thing that we want to do is, once you are receiving this data, we want to make sure that we are doing something with it. Because we want to have that data and we want to understand what we're doing well, what we could improve on, and we need to understand what that data is actually telling us. Because perhaps all of you are not clinicians, so it might not actually make sense to you when you're receiving this data. So you want to make sure that you're understanding what it is actually telling you. The other thing that we want to consider is when looking at incident data, which I know that you would collect and you would receive at your meetings. So you would receive a summary of your incidents, you know, the trends that are related to those incidents. But considering again, what questions could you ask around the use of telehealth there as well? So a good example was the use of VED after a resident has had a fall. Okay, and that is in both ways. So it's ensuring that your resident may have been seen by telehealth because they've had an assessment and the clinical team have deemed that it was appropriate to use telehealth in that instance. But also from your perspective, making sure that your residents who have had a fall who need to go to hospital are still going to hospital and receiving that treatment. So, and if they're not, or there are, you know, a high number of hospital transfers, let's say, how can you use that data to ask more questions? Ask those why questions. Why are we sending why have we sent 10 residents to hospital this month? Yeah, and what was the reason behind it? Because that can also guide us in a lot of different directions to where we can make some improvements or where we need to invest a little more time or education with our teams. The other thing that Kate was talking about as well was ensuring that we share the data that we collect. So we're great at collecting data at, you know, the leadership level in aged care, and we report up where we need to report up. But, you know, it's making sure that everyone is across that data that we're collecting. What is it telling us? What is the story behind us? And how are we going to use that to really enhance our use of telehealth moving forward? So when we're thinking about presenting data as well, so we spoke a lot to the teams at our bespoke training, and we will again be covering this off when we go to the regional training. Really important to consider lots of different data sources. So you probably don't want to just see graphs and numbers as well and financial data. You're wanting to hear those stories. thinking about appealing to both the head and the heart. So what are the statistics telling you? What is that story telling you about the use of telehealth? Are we improving each month? Are we not using the technology? Who are we using the technology for? Like, what kind of appointments are we accessing? What other appointments could we be accessing? But again, it's also thinking about those stories that are really important. And again, Kathy, just going to highlight your story is perfect, because I'm sure that that is a story that you would love to hear as an exec or a board about how effective this system is on the outcome of that particular resident. So asking those questions and being really visible and, out and being seen, and asking those questions about what is the impact of this telehealth or digital solutions on the residents that you're providing care for. Because stories are a great way of sharing with team members from lots of different areas. So sharing across your non-clinical teams, looking at how you can share stories in different ways to your consumers and representatives, because what we're all aiming to do is to improve the use and increase the awareness of telehealth, and really highlighting the positive outcomes that it can have for our residents. And access to services, timely access, etc. But how we share that story and how we receive that story is going to be in different ways, and different ways for different scenarios. Yeah. So what we've spoken to with your team members is really thinking about how can we present data in different ways? How can we share to you guys the number of appointments? How can we really highlight where we're doing well? How can we highlight where we need some assistance, for additional education or additional resources, but also highlighting our wins and those big achievements and the outcomes that it's had for the residents themselves. So that's an area that we spent quite a bit of time on, and, really working with the teams to understand. We all like presenting data in different ways because we all have different personality types, but just thinking a little bit differently as well about how we can share the story in lots of different avenues. And this is a great way of explaining that again, because we receive a image of a graph which tells us that, we've had, for example, a number of residents over the months transferred to ED post-fall. And as a board or an exec, it might highlight something to you. It might raise a concern. It might force you to ask a question about, what happened in March? Why are we why have we had an increase in the number of residents going to hospital in March? But then you look at the image on the right, and the image on the right, for some people, will force you to ask a few more questions. And it really tells you that story of, it forces you to ask why, what's happening here? What is going on with this resident? Why are they in hospital? Look at that. They've got their food in front of them. Is this the best place for our resident to be? Yeah. So really thinking about that presentation of data, and thinking about asking questions differently of your team. So when you're getting those graphs, or you're getting that really quantitative data, asking them for more of that qualitative data as well. So give me a story and an example of what's gone well with your use of telehealth. And that can really encourage your team members. It raises that awareness of how important the use of telehealth is and how it is a priority for you as that executive or team members. Sharing of consumer stories shows that residents are central and to the core of what we're trying to achieve. And so again, what did the graph tell us? It told us that we want to do something about the number of residents being transferred to hospital. But what this story tells us is the true impact of telehealth on our resident and representatives. The sharing of consumer stories and those positive news stories is important, and, can lead, can really highlight how we've improved their experience, which is ultimately, again, going back to our why. Why are we all here? It's to make sure our residents are receiving the best possible care in the most timely manner. So case studies are another great way that we highlighted with your teams around sharing those stories. And this is, sort of similar to Kathy's story, but we've heard a few different versions over our travels already, and talking about Bob and Mary. So Bob is needing to travel 6 hours to see his geriatrician because he lives in regional Vic, and he lives with dementia, and he becomes more agitated in the afternoon. He also has quite limited mobility. So Mary and Bob's daughter, Diane, accompany Bob to any of his appointments that he goes to. And these appointments can be quite a long wait and quite a long way away as well. So this is not a positive experience necessarily for Bob or for Mary or for Diane. It has a lot of impacts on everybody involved, and it also has an impact on the staff as well, because when Bob comes back after spending 6 hours travelling, let alone the wait time to see his geriatrician, living with dementia, travelling and having all of these different changes is not always a positive experience. So, Bob might be a bit more unsettled when he comes back to the facility and he's requiring more staff assistance. So it's not really a good outcome for anybody who's involved. So we look at the different alternative, which is the use of telehealth, and Bob's able to see his geriatrician from the comfort of his own home via that iPad. And even better, the opportunities with telehealth mean that Diane doesn't actually need to physically be in the facility as well. She's able to dial into that appointment from her home, which, might be an hour away from Bob's home as well. The other positive with the use of telehealth that we want to consider is that the geriatrician can actually see Bob in his own environment. So we're taking away all these additional factors of Bob being removed from his home, he's out of routine, he's been in an ambulance for 3 hours, he's confused, so he's not in his usual state, okay? It's also the nursing, the other highlight for the use of telehealth is that the nurse can attend that appointment, as opposed to sending your resident out to attend, at an organisation hours away. The nurse from your team can actually attend the appointment and can hear firsthand what the doctor's recommendations are or what the specialist recommendations are. So we've got that firsthand information that can directly go into the notes, and those actions can be taken immediately. So again, that's that more timely access to care, and we're making sure that the information is accurate and it's not being lost in translation along the way as well. More positive outcomes for Bob because we're not moving him around multiple locations, so he's less stressed and agitated compared to when he goes out to those in-person appointments. And Mary and Diane are also much less stressed and a lot happier as well. So something that seems quite simple and something that, we don't really think about has a lot of positive outcomes, not just for the patient or the resident who's accessing that service. So it's really important to think about, how are we measuring the impact that it's had beyond just the patient or the resident receiving access to that appointment? What impact has it had on your clinical teams? What impact has it had on the family members, the representatives as well? So these are all questions just to think about when you're starting to look at what data you're collecting and what stories you can collect as well. So again, when we're thinking back to, data and the use of telehealth and linking back to clinical governance, it's really important to remember that if we're not monitoring, then how are we going to improve and learn? Yeah. So if you don't know what you don't know, then how can you make an improvement? How can you set that strategic focus of how you're going to improve the use of telehealth? And again, thinking back to those 5 pillars that are in that clinical governance and just starting there and starting really simple if you're not collecting any data. What is one question, what is one piece of information that you want to collect or understand more that fit into each of those pillars, which are, the leadership and culture, your workforce, your consumers, clinical practice, and risk management. So when we start collecting this information, it helps us to understand that story, and then it's going to help give you that more information to be able to guide your team's direction and focus. So you can move on from the monitoring to actually put actions in place to have that improvement in the service as well. Now here we've got a few different examples of data that you might want to start collecting if you're looking for a starting point. So considering things like, are you collecting the use of VED and the outcome for that resident? So when we're talking about that, what we're meaning is your resident being seen by virtual ED and then remaining in their facility? Or are they being seen by virtual ED and then still going to the hospital? Or how many residents are still being sent to hospital? Yeah. And what are the VED appointments for? This is a really interesting point of data to collect as well, and it can take you off into different directions. So, for example, are the VED appointments being used for clinical care because there's something, you know, your residents are suddenly unwell and they need to be assessed? Is it post a clinical incident where you're wanting them to be reviewed? Or is it for something which we've heard quite a lot of already in just our 2 bespoke sessions, is accessing scripts? So if you're using virtual ED to access scripts, because that could indicate another area of focus that you want to have a look at, because, you know, why are we not able to access scripts through GPs? Yeah. Why are we having to access these scripts after hours? So it can guide you in a whole lot of different directions. Something else that you want to consider is around the training of your staff. How many of your staff actually know about telehealth, and how many of them know how to actually use that Vision Flex, or how do they know how to actually set up that appointment? Because that is another key theme that we've already identified in these 2 groups, is that education is really key, and making sure that your staff have the confidence to be able to facilitate these appointments. You know, how do you know that your consumers are aware that they have a choice? You know, what appointments do your consumers currently access, and are they aware of what they can access through telehealth or in person? And again, looking at those urgent, you know, the hospital transfers versus VED access as well. Now I'm going to hand back over to Kate to talk about quality improvement.
Awesome. Any questions before we move on? Any questions or any thoughts? No? Okay. I'm going to skim over the next few slides because we want to also touch on change management. But like I was saying, a key part of the training that we've been providing to participants has been on quality improvement. So really trying to get leaders to understand that their role is about quality improvement and fostering that continuous improvement culture. If you haven't seen it, I would really recommend that you go to the Victorian Clinical Governance Framework, because it was updated last year in 2024, and they actually have included a clinical governance mindset in there now. And the clinical governance mindset is all about your staff knowing how to apply clinical governance. And they talk about 3 different attributes that you need. So you need adaptive leadership, this continuous improvement focus, and to partner with consumers. So we'll briefly touch on it, but I would encourage you to go and have a look in that framework yourself. Now, adaptive leadership is something that we've tried to incorporate in our training with RACS participants to really because as you said, you're in an adaptive environment. Aged care, every day is a different day, isn't it? So thinking on your feet and being able to lead a team, to be responsive, and to be able to lead from the ground up, to really bring people on board with change, and to give them a voice, to feel like they're being heard and listened to, and part of the change is really important. So yeah, and that's part of having a clinical governance mindset. The next part that we've focused on a lot today is partnering with consumers. And so we've really tried to instill that in our training. How do we partner with consumers? How do we engage with co-design to really have residents and their representatives, or even our external stakeholders, our medical specialists, they could be our key stakeholders too. How do we partner with them when we're wanting to make changes? And the real focus that we've had is on continuous improvement. And this is all about knowing how you're doing. So being comfortable looking at data, interrogating data, being comfortable embracing learning, wanting to do better. Yeah, wanting to be better and do better, and not being afraid to try something. And, you know, if it doesn't work, that's okay. What could we do differently again? So what we really did in our workshop sessions is we introduced the Institute for Healthcare Improvements model for improvement, this model here on the screen, if you've seen that before. So that's an improvement model which is used a lot in health and aged care. It's really based on answering 3 questions first to assist you with planning a change. And those questions are, what are you trying to accomplish? How do you know if the change will be an improvement? And what changes do you have to make to actually make that improvement? So we've introduced participants to this framework. And we've also introduced them to the Plan, Do, Study, Act cycle, which you might be aware of. So encouraging them to come up with a small idea, something small that they can test themselves to see if it actually improves the use of telehealth ultimately. Yeah. So with the bespoke sessions, we actually worked with teams to try something new. One team increased the use of Vision Flex by training staff, and quite a lot of staff weren't trained in how to use it. Another team really focused on the use of VED, for instance, and overcoming barriers that were stopping its use. So it was all about getting participants familiar with the model to try something new. The other thing that we focused on is, okay, once you've once you've made an improvement, you know that something is an improvement, how do you work with the team to really implement change, to bring others on board who might be resistive? And that's where we introduce participants to Kotter's 8 Steps framework. And we're going to give you a bit of a refresher on that this afternoon, not in detail, but just a bit of a glance at the change framework that we've introduced participants to, because lots of change happens in aged care, and we want to make sure that we're implementing things in a sustainable way so that when something else comes, you know, it's business as usual with the changes that we've made. Now, I'm just going to share my screen because we want to show you a video by Simon Sinek. Has anyone heard of Simon Sinek? Is that sharing now, Kat? Can you see that? Oh, I think I just need to share with sound, and I always do this. I apologise. Okay, I'm sharing with sound. Let's take 4 minutes to watch this video, and then we'll come back and have a little chat.
If I asked you, do you need to change? And you said to me, no, I'd be worried. You know, like, you think you've figured everything out, like emotionally, professionally, all your relationships, everything's golden. Oh, okay. How's that working out for you? You know, I think the answer is always yes, which is to view ourselves or our organizations as works in progress. You know, that is an infinite mindset. Infinite mindset is fundamentally constant improvement. So, you know, there's big change, there's little change, there's tweaks, there's dramatic change. Sometimes it's reacting to changing cultures, changes in culture, politics, technology. You know, sometimes the change is our own, sometimes we have to react to it. But I think the honest answer is yes, we have to change. There's always opportunity to improve something. So there's this notion in businesses that people fear change, which is just fundamentally not true. People fear sudden change, you know, but incremental change is not threatening. People fear change that threatens them, right? And very often the way we change manage is we do lots of PowerPoint presentations about what's coming and don't worry, and we have all these things, and we treat it very rationally, and what we're ignoring is the emotional response. Now, there are some people who love change. It's an infinite-minded thing to embrace uncertainty, to see opportunity in surprise. For some people, especially people who have gotten good at doing something for 10 years, 20 years, that all of a sudden you say you're going to change it, they fear, again, there's that emotional word, they fear that they won't know how to, or it will set them back. And so no number of rational assurances will help them get over that. At some point, we have to just let them go through the process. The law of diffusion is a theory that was proposed in the 50s or 60s by Emmett Rogers. And basically all populations shift across the standard deviation, the old bell curve. If you have high performers, you have low performers, you know, et cetera, stuff like that. And what the law of diffusion tells us is that the first 2.5% of your population are your innovators. This is your big idea people. Elon Musk, Steve Jobs, right? Then you have 13.5% of your population that are your early adopters. These are the people who are willing to pay a premium, suffer an inconvenience, extend extra energy to be a part of something that reflects their own beliefs, stand in line to see Star Wars a week before it comes out, even though you can just wait 2 or 3 weeks and buy a ticket and go in. For them, it's worth it, right? And then you have your early and late majority, who are more cynical, more practical. What's in it for me? What guarantee am I going to have? What happens if it goes wrong? Will I get my money back? Like that kind of stuff, you know?
You've ever seen the YouTube video of the guy dancing solo, and then the early adopters come, and then next everyone's coming, and that's a movement, right?
That's a great example of how it works. Now amplify that to an organization. The innovator is the person who came up with the idea, the person who first started dancing, and other people said, "You're an idiot," right? But a small group said, yeah, but it's fun. You know, we'll give it a try. And then before you know it, it's a perfect example of how law of diffusions work and how tipping points work. When we try to affect change inside an organization, we obviously want to affect the bell. We want to affect the majority of the company. But that's not how change happens. Because the majority will not try something until someone has tried it first. They're risk intolerant. And so what you actually want to do is aim for the early adopters. You aim for the people who go, all right, it's not perfect, we'll give it a try. And if you can get about 15 to 18% market penetration, it just tips. Again, because someone else has tried it. It's happened. And so the way you affect change in an organization is not to thrust it upon everybody, because you're going to get massive resistance from the majority, but rather identify the pockets of early adopters, individuals and teams, that are willing to try this new thing that you want to try, get the kinks out, and then before you know it, what ends up happening is the majority starts getting angry, like, why weren't we given this? Well, that's called demand. We love that. So it's about building demand and creating that tipping point. That's a more effective way to create sticky change.
So we played that to the workshop participants, and it resonated really well, because Simon has just got a really great way of explaining very complex things very, very easily. And we got people thinking. We had a lot of people even identify as early adopters, which is great. So, you know, and I think it made people realise too that a lot of change is happening in aged care. Change happens every single day. And like Simon said, people aren't resistive to change. They're resistive to sudden change where it's thrusted upon them. Here we go. I'm just up to where we need to be. So that leads us on to why people might resist change. And get your fingers typing again. Why do you think people resist change? Now, this was a discussion that we had with workshop participants, and it was great to hear. Lots of different ideas. Pop it in the chat. What's your experience with change, and why do you think people resist change? Fear of increased workload. Exactly. Keep typing. I'm going to just go over the main ones as you guys type. Loss of control is probably the first one. You know, someone might have been doing their job for the last 10 years and something is imposed on them. Exactly, Margaret, not feeling part of the design process. So autonomy is very, very important, having autonomy at work. So how do we bring people on board and get them to be part of the change? Excess uncertainty. We haven't got that vision. We can't tell them what the future is going to look like. So better the devil I know and keep doing what I'm doing. Surprises or too many change at once. You know, if we can actually limit change just to be what's necessary, it's much better than trying to impose too many things at once. Loss of face or embarrassment, feeling as though they might fail at something. They don't have the skills to do something. So concerns about competence, more work. That came up, wasn't it? Not enough time, more work. Yeah, fear of increased workload. So how do we really sell that vision and get people connected to our vision? Because initially change is quite often a little bit more work, but sometimes, you know, quite often we make changes so that in the end it will be less work. And yeah, a ripple effect. Quite often you'll just have someone who is negative about the change and they're influential, and they can have that ripple effect with others. But equally, you could have an early adopter, someone who's quite positive about the changes that you make, and they could have a positive ripple effect on others. So we went through this with participants as well. And this leads us into Cotter's 8-step framework, change management model that we presented. And I'm going to get Kath just to give you an overview of that. Okay. Thanks, Kath.
Thank you. Yeah, some great examples there as well. And again, very consistent to what we were hearing from your teams when we've been out to region workshops and when we've run these programs at other times as well. So very consistent. So we all know where the barriers are and where the resistance comes from. So how do we approach it and make sure that we have effective change? And that's what this whole program is about, isn't it? It's about implementing that sustainable change and implementing change that is going to be effective and long lasting. And the key word in this slide is sustainable. So we don't want to be spending all of this time and money invested in an improvement only to have it fall over in a few months' time when it loses traction. And I'm sure that we've all experienced change that has, I can see Kathy nodding, experienced change that has had that effect. So it's really dropped off after that intensive, focus in the initial months. And there's a few reasons behind that. So what we want to do is avoid that happening. And that's the focus that we've had on these workshops with your team members who have attended the bespoke, and the focus that we're going to have next week at those regional workshops as well. So we have spent, and we will be spending, a lot of time with your team members on change management in those sessions. And like Kate was saying, we're focused on Kotter's change management framework. There's a reason why we use this model, and I'm not sure whether you guys have used that before or heard of it. There are lots of different change management models out there, and they're all slightly different. However, they have similar principles. And the reason that we've chosen Kotter's is for a few different reasons, but it's quite simple to follow. And it has been recently updated as well. So it was first launched in 2014 and it's been updated since then as well. So now a part of the changes is that the 8 steps don't necessarily need to go in that order, and they can be done, multiple steps can be done at the same time, okay? So no change model is perfect. However, the reason we have chosen this model is because it is easy to implement. So we're all about keeping things simple. We're working with busy team members. Like you guys were saying, there are lots of changes happening all the time in aged care. So we want something that is easy to implement. It's a very big focus on buy-in from various stakeholders. And that's something that we've been really highlighting in our training as well, is making sure that we're aware of all of our stakeholders that are going to be, that need to be across this change and be across telehealth in particular. It highlights and focuses on that sense of urgency, which we're going to talk about now as we go through each of the steps, and a very big focus on communication and buy-in. And I think that was a key theme that came up in the chat as well, was around where things didn't go necessarily well, was relating to that lack of communication or poor communication relating to the change that's being implemented. Excuse me. So underpinning the 8 steps are 4 key principles in Kotter's change model. And it's something that should be considered throughout the entire change management process. And you can see the 4 pillars here, or 4 principles here. And the first one that we want to talk about is leadership and management. And you in your roles are leaders and managers, but it's really important that the managers support, or you are aware of the change and the requirement for change, but you need to be supportive of it as well for the initiative to be successful. Okay, so you need to be across what telehealth is, why it's important, what are we trying to achieve, and then be really supportive of that change, being across all of the information, being across those stories and sharing that with your teams. The second is head and heart. So we know as well, when we're going back to when we were talking about data, different types of data appeal to different people, but change is not, we think about change as a rational thing, and we often forget about the emotional response that it can have, or the emotional impact that it can have on a person. So we might have all the great plans in place, and all of those steps put in place for the process for the change to be initiated. But if we haven't appealed to the person's heart and we haven't appealed to their why, then we are going to have less effect of this change being initiated. So we need to make sure, again, going back to that, making sure that we're appealing to both the head and the heart for for the change to be successful. People need to feel positive about what they need to do. If you think about yourself, when are you more likely to be involved in a change and be more likely to be supportive of it? Is it when someone comes and tells you need to do it because your stats are off? Or is it when you understand the story behind it and what it is that you're trying to achieve, and that good news story like Kathy shared again earlier? You know, what is the impact that it can have on our residents? The next principle is around select few and diverse many. So we spoke a lot to your teams around having that core group of supporters and looking at, again, the different stakeholders. So looking at people from different areas of the organisation, thinking about different people in different roles as well, different levels. So we spoke about, you know, talking to your exec and management and, you know, your board as well, and getting their input, and, you know, having them involved in the change initiative from the starting point. And the final is the have to and want to. So again, change is going to be much more effective when people want to do it rather than when we're dragging them to and telling them that they have to do it. So it's really important, you know, to consider all of these key principles as we move through each of the steps, and they're designed to help keep the momentum going throughout this transformation and that initiative that we're putting in place. Okay. So there are 8 steps, as we're saying, through Kotter's model, and we're briefly going to go over each of the steps now. But you can see that by using a model as well, it gives your teams and yourselves a model so that you can have a framework to follow. Yep. So we can all have great ideas, and we can, it's like the quality improvement model. Kate uses a great analogy of having a recipe. You know, we can all have an idea of how we're going to bake a chocolate cake, but if we don't have a recipe to follow, we're all going to make cakes that are going to come out slightly differently. And we want to make sure that we're all on the same page, and using a framework like Kotter's can help, you know, make sure that you've got that plan in place to help drive and sustain that change. Okay. So step 1 is all about creating that urgency. So it's about getting people thinking about the why again. Why is it that we need to change? Why is it that we need to look at increasing our use of telehealth? Yep. And it links back nicely to when we were speaking about data earlier. If you don't understand what your use of VED is, you know, then how are you going to know that you're underutilizing it? And then how can you take those steps to improve the use? So when we're thinking about creating that urgency, we're wanting to think about explaining to our teams, you know, how are we going to show that the change is necessary? How do we use that data to share that story, to say, we are not using this telehealth to our best ability. This is the opportunities that we have for the use of telehealth. Opportunities are really key. We don't want to focus on what we're not doing. We want to focus on what we can be doing and where we can be heading. Yeah. So thinking about what are the opportunities that we want to share with our team? Getting people thinking and talking about the change and sharing the why behind the change and why it is needed. So not just presenting those statistics back and saying, hey guys, I want you to improve the use of telehealth. You've had 2 appointments last month and I want you to have 10 this month. That's not going to get people on board. Sharing that information is important so that they're aware of, you know, where they're at. And again, it's that sharing of data and sharing of information across all team members, but that's not the story behind it. You know, what does it matter if we have 2 appointments? Why do we need to get to 10? That's where we need to create that urgency. We need to share that story to create the case for driving change. What is going to happen if we do not implement the use of telehealth now? What's going to happen if we don't use this Vision Flex equipment? What's going to happen if we don't get on board and start engaging with our specialist teams and using that, increasing the use of virtual ED as well. Yep. So creating that urgency helps to get people on board and understand the story as well behind the change. Yep. It's human nature for us to maintain, you know, wanting to stay where we are. And that came up a bit in your feedback as well about, you know, we've been doing this for a while, or we haven't been using telehealth and we've been fine. But we want to, you know, when we use this sense of urgency and we present that information, it can spark that motivation for your team to initiate that change process if we're including all of the right information. The second is forming that powerful coalition. An important part of change management is knowing that it can't be done alone. And sometimes this is where we don't do things as well. And this is speaking from my 20 years of experience as a nurse, being through many, many changes. We don't always, where the biggest barriers are when people don't feel like they've been a part of the change. Yeah. So thinking about, again, forming that strong team. So who are the team members? And this is what we covered with the training that we've had and we'll be covering. Who are your stakeholders? And thinking beyond just your team, your small team that you work with. So, you know, if you're a clinician, not thinking beyond your clinical team. What about your leisure and lifestyle team? What about your food services team? What about your management and executive? What about your education department, your IT department? And so we spent quite a lot of time talking about who key stakeholders are, and then further identifying who the change leaders might be. Who are the key people that we want on our team to be a part of this process? And really encouraging your team members to think beyond just their small cohort that they're used to working with. We want to get everybody involved. We want to have consumer, thinking about your consumers as well. And how do we get that leadership buy-in? How are we going to involve you in the process of that change so that you're aware of what we're trying to achieve and the why behind it, and what we might need to support us putting that change in place to be effective. We also talk about, so we show the video that we did earlier around those early adopters and helping people to identify, who might be your early adopters. Yeah. And something else that we cover off is talking about those people who may be an important stakeholder, but might be what we term no-nos, or we've learnt a new term now of historians. So people who are not always happy about change, and there's people in every organisation who are going to be the ones who say this is not going to work. So how do we get those people involved in this process? How do we identify, how do we keep them involved in the change? How do we communicate with them? And how do we make sure that we are listening to what the barriers might be to implementing this change? So not discounting people who we think are going to be challenging to implementing a change, but it's about rethinking how we listen to what they're saying to us. Yep. So not thinking that they're just negative Nellies, because a lot of the time the no-nos are people who have been in the organisation for many years, have seen changes come, changes go, managers come, managers go, and think, well, this is just another change. So it's really important that we don't exclude those people from being a part of our coalition as well. So again, we spent a lot of time and we kept referring back to this stakeholder list and thinking about, the having a list of stakeholders. So considering everybody and then thinking about where they fit into this matrix when we're talking about telehealth. Who is it that we need to involve at what point and to what level, and thinking about all of those different groups and different experience levels, etc. Step 3 is around talking about a vision for change. And with the bespoke workshops, we set an aim, or we helped the teams create an aim for their improving the use of telehealth. But then we also, in session 2, looked at creating a vision, because a vision is different to an aim. An aim is is our goal of what we're trying to achieve. But our vision is why, why are we wanting to achieve that? What is the ultimate outcome? And so from your perspective, moving forward, when you're thinking about the use of telehealth, how does the use of telehealth fit into your strategic vision for your organisation? Yeah, what is it that you're wanting to achieve? What is your vision? And then thinking about how are you going to incorporate that? How can you promote that vision to your team so that they know that you are on board with the use of telehealth, and you're seeing it as a key focus, and you see how it aligns with the broader organisational vision as well. So the two organisations that we worked with were either finished a vision or were towards finalising a vision for the use of telehealth. And something that we spoke about was, how do you share that vision? How do you keep it front of mind for all of your teams so that they're aware of what we're trying to achieve? So talking about how we can embed it into day-to-day conversations, into communications, how can we, making sure that the vision appeals to, again, the head and the heart, and, you know, making sure that it's really used where possible, because the more that we talk about it and the more that we relate it back to our use of telehealth, you know, relating our vision back to our use of telehealth, that's when we start to get people on board as well, because it's that continual messaging, and it helps to embed that mindset that, you know, telehealth and the use of telehealth is really important for all of these reasons. Step 4 is around that communication. And again, we know how important communication is, because we want, in order to engage and enable change, we need to persistently communicate, and we need to communicate in different ways. We can't just communicate by sending a memo or an email or putting a flyer up and then ticking that box to say that we've communicated. People like to hear information in different ways. People need to hear information several times before it stays in our brain. So again, thinking about your vision for your organisation, and then asking the question, you know, going around and asking the question of your team members about their vision for the use of telehealth and what are you doing to meet that vision, and then, you know, showcasing it. And, you know, that walking the talk is really important, because if you want people to be engaged in your change idea and you want to be seen as supportive of that change, then you need to be visible. You need to be out there asking those questions, showing interest and listening to the feedback that you're getting as well. So again, even when you're in your exec or your board positions, think about what your vision is going to be for your organisation, and then how are you going to link things that you do moving forward back to that vision as well. And don't overcomplicate it. Like one sentence, keep it really simple. The simpler, the better, because we're all busy and we want something that you can just rattle off and keep retained in your head amongst everything else that's in there. Again, just highlighting that we want to communicate in different ways to our different team members, and don't exclude people who you don't think telehealth is related to. So we had one team from our bespoke workshops who were talking about the food services team and how they need to ensure that they communicate with the food services team about when appointments are happening because they'll be happening in resident rooms and it might impact on the delivery of meals, for example, or access to food. So they're already thinking differently after just these 2 training sessions about, okay, how do we need to communicate with different groups in our organisation and not just focus on the clinical teams, yeah? And think about how we're going to communicate differently. So we might be using one form of communication for you guys, probably email or meetings, but what other ways can you communicate differently to make sure everyone is on the same page with your vision for the use of telehealth? The other thing that we spoke a lot about and we spent a bit of time in session 2 was about creating those short-term wins. So when we're undergoing that change management, we don't want to do a sit and forget. We don't want to set that long-term goal of increasing the use of telehealth and then, you know, not focusing on it until, you know, that bi-monthly meeting when the report's due and we're looking at that data again. So we had a big focus on breaking up the change into phases and celebrating those smaller goals. And that is important for many reasons. Number 1, it keeps that team morale up. Number 2, it keeps that focus on where your goal is and how you're going to meet it. And it highlights, you know, it celebrates the good work that has happened. And it's about, you know, thinking about what are those small wins. Maybe it is something as simple as, okay, we're going to start reporting you know, the telehealth data, and we're going to aim to increase our appointments by 10% each week. And then each time there is a win, we celebrate that win. And this is where you guys can be a really important component of that as well. So we have suggested as well, no worries, Kathy. We've suggested as well, you know, think about those wins. How are you sharing those wins with your exec and board to say, hey, we've improved our use of telehealth by by 10% each week for the last 2 weeks. We're going to have a staff morning tea to celebrate that. And this is where your roles as exec and board can be really key. So if if you're aware of the changes that are being put in place, or you're asking those questions, then you're going to you can go and help to celebrate those wins, give it a pat on the shoulder, go and attend those morning teas and give that feedback of, how great it is that the work is being done and how important it is to improve, for those residents to access that timely care. And from your perspective as an exec or a board, why is this important? And, again, going back to that vision, our vision as an organisation is X. And, by you improving the use of telehealth, you are helping to work towards that vision. Yeah. So really important to ask that. Don't wait to be told. Think about how you can ask those questions and really help your teams to celebrate those wins. The other step 7 is around building on the change. Yep. And I guess sometimes this is where change tends to fall over, is that we implement it and then we sit and we forget. We think that it's done. Yep. So implementing and sustaining change is around remembering that we need to move through these steps and make sure that that change is embedded. We can't just do it once and think that things are perfect and then move on. We need to keep going until we are satisfied that it is really embedded. And we need to have a look after each phase as well. So, ask those questions of your team. Hey, how's it going? How's that change going with telehealth? What's gone really well? What are some of the barriers that you came across, and how can we how can we look at things differently? How can we assist as an exec or a board? Yeah. What are your goals? What are your next goals for the next phase of this change? How are we going to continue to make sure that this just becomes, day-to-day practice? And step 8 finally is around anchoring those changes. So it's about, embedding it into that business as usual. So when a new staff member comes to your organisation, they just know from orientation that you do telehealth, you have your Vision Flex, or you have your iPad, it's set up, everyone has access who should have access. It's not something that you have to think about as a reactive approach. It's something that is just embedded and a part of day-to-day practice. Something that Kate spoke about earlier was around those policies and procedures. So something that you can consider from your roles is, have we got telehealth embedded in our policies and procedures? That's a good starting point to ask. And if not, okay, where do we need to start with that? Because like Kate was saying, it doesn't appear. Maybe there might be some reference in some policies, but it's not consistent, and it's not how are we governing that we are providing that service and that it's done correctly and safely? So a good starting point for you in your roles is to consider about those policies, procedures, and think about job descriptions as well. How can you embed this as a part of your orientation process in your position descriptions? How do you, again, make sure that everyone has access from the point of entry into your service? As a worker, they have access to all of those systems, and they're given training on how to use those systems, which is really key as well. So again, just reflecting back to, how do we pull all of this together? Your managers and your team members are the ones who have that operational focus. So how does it look in practice to get that use of telehealth, increased? How does it look for making sure that our residents are able to access all of these opportunities through the use of telehealth or digital solutions? And that's great, but you as the board or you as the executive, have that strategic focus as well. So, by working together and being involved in that change process and being actively participating, being visible and out there asking those questions, then we're going to get to that ultimate goal, which is that accessible and timely healthcare for residents, which is, again, we go back to our why, and that's what the key theme that came through that as well, which is what we're all wanting to achieve. So as Kate spoke about earlier, all of the participants in our workshops, no matter which ones, have received or will receive a pack with some simple change management tools. And the ones highlighted in red are the ones that we've either gone over in detail in the bespoke workshops and done some planning, some completion of them. And in the regional workshops upcoming, everyone will be discussing these tools and what they look like in more of a group scenario. Okay, so everyone will have the opportunity to take notes and to think about it and to collaborate with their team members from their organisation if they're attending. And again, if you're not sure or if you have team members who haven't registered, no problem, Margaret, thank you, then you can still register. Just flick Katrina that email that she's through earlier. But we know, again, that tools are great. But, you know, handing someone a pack with more paperwork is not going to lead to effective change. It's the framework and the understanding of change management skills, which is going to be what is the changing factor, you know, that factor that is going to lead to successful change in your organisation. It's the training and the skills behind using that framework. So in summary, we've got our key messages from today, and that is that we do require, you know, that successful implementation of telehealth or successful, you know, expansion of the use of telehealth and digital solutions is going to require that strong clinical governance. And clinical governance, as you already know, is not just about being compliant. We're not here to tick a box and meet the minimum standards. We are here to do the best that we can for our residents. And that is, you know, clinical governance is underpinned by continuous improvement. And those are the skills that you're investing, you know, your team members on the floor who attend these workshops are also learning along the way so that they can, you know, be upskilled and be able to lead these changes. Boards have the responsibility for the strategic planning for digital health and telehealth. So go away and have a think about, you know, what it is that you want to achieve, what is it that you need to know to start with. Go back to the collection of data and looking at that information and that story to help guide your future direction. Boards and executive need to also ensure that staff have access to the right training and resources to make sure resident care is optimised. And we can't understate that enough. You ask the questions. Ask the questions around what training has been received or what resources are needed, because don't always assume that the answer has been provided to you. Have a look at what's actually going on. You know, thinking about those, you know, how are you going to know how collecting that data to know how you're going and how you can further improve, and helping to, you know, looking at that data to help you identify where you want to drive that change. Where are you going to focus your attention? What are you going to invest more time, energy, you know, resources into? Cannot understate enough that supporting frontline leaders to build the skills in quality improvement is critical. So the changes that we've seen in just those 2 sessions with the bespoke workshops was amazing, and went well beyond what we expected for, you know, the 2-week turnaround time, but they were very invested and they were very committed and excited by what they had achieved in such a short period of time. And that's what the right training and skills does for your leaders. And imagine what that translates to in the future, because this change management and quality improvement skills are not just about telehealth. These are skills that can be used in many different ways. Okay, so it's definitely an investment. And, you know, thinking about that change management framework, let's not wing it. Let's do it based on something that has a recipe for us to follow, so that we make sure that we're following all of those steps. Now, we have done the staff trade. So we've done our bespoke workshops, and next week we will be doing our 7 regional training workshops. And we would encourage you after today's session to go and have a look at the change readiness audit that was completed by your organisation, and also have a look at your clinical governance framework and think about how you can embed the use of telehealth into that. Now, as Kate spoke about briefly at the start, we do have a digital health online collaborative, which the first session will be held on the 27th of May. And it is encouraged that we have representatives from each of the organisations in the PHN to attend. So your role would be great if you could make sure that you do have somebody attending the training firstly, but then also is engaging in this program, which is going to promote best practice and continue to build that capability in enhancing the use of digital health in residential aged care. So we will be facilitating the first session, and then the PHN team will be continuing on from there. Okay. Really important opportunity for people to collaborate, to share ideas across the region as well, because let's not reinvent the wheel. Let's share our wins and let's share our ideas. So a really good opportunity, and please do encourage your team members to attend that, or a representative. Oh, Kate. Yep.
Sorry, I'll just, no, you didn't forget anything, but I just thought, and the first session, we've actually got one of the groups, one of the participants from the bespoke session who implemented a change. She's going to be presenting. So you're going to actually hear from a service who has made a change in regards to the use of telehealth. And yeah, it might give you some ideas. So you won't just be hearing from us.
No. And so finally, we are this whole program is going to be evaluated. So we have, like Kate was saying, we have an external consultant from our team. So she will be doing all of the evaluation of the effectiveness of the program, and that includes surveys from the participants, from your team members, but also interviews. And this is where we would love for you to be involved. So Kimberly is the one who is going to be conducting those interviews. So if you would like to be a part of that, it will be about 15-minute phone interview just to talk about your experience of this session and your thoughts. And we would very much appreciate if you would like to register your interest. You can use the QR code. We will send the slides through after today's session as well. But we would love to hear from you. And again, completely separate to Kate and I, so you can be honest as you like. Now, before we wrap up, are there any questions that anybody wanted to raise before we say farewell for today? Amazing. Well, thank you so much for registering to come along today and for attending today's session. We very much appreciate it, and we're very excited to see how committed you are to, understanding more about telehealth and how we can, how it might look in the future for your organisation, and hearing about what we are working with your teams on. So we know that you're very busy, and it's a strange week as well between Easter and another long weekend. So thank you very much for coming along. And yes, please, we look forward to meeting your teams at the regional workshops next week. But thank you very much. And Katrina, I don't know if you want to say any more, but otherwise.
No, thank you everyone for coming, and thank you Kate and Kathy for doing a wonderful presentation. Very grateful.
Yes.
And I'll send out reminders for the face-to-face workshops today. And please, yes, encourage your staff, if you haven't done so. The dates and workshop locations are in the chat, and my email is too. Wonderful.
Wonderful. Thank you. And we, have a great day.